Wenstrup.
Thank you, Mr. Chairman. I appreciate it. Thank you all for being here today. This is something that's near and dear to my heart, and I'm glad we're here to talk about MICV. You know, this is a program that has had bipartisan support historically. We've been able to reauthorize it. I'm looking forward to another reauthorization of a program that helps so many. And one of the things that I really appreciate about the program is that it's evidence-based, and it demonstrates significant positive outcomes. Reducing child abuse, neglect, improving maternal and child health, and improving self-sufficiency. All those things are so key to the success of the program, and it's great to see the successes firsthand here today. But we also see it in our district. It's important to me in my district. So many people benefit from this program. You know, in my district, for example, Every Child Succeeds has a key partnership with Cincinnati Children's Hospital. That's a key component. And by offering these services as early as pregnancy, which is key, mothers can be equipped with the skills they need to bring their child up in a positive, nurturing home. And that's what we're after. And behavioral health resources for the mother are also imperative to the child's success. But what I really like about the program is it's very focused on preventive health and what we can do to be proactive, to be out ahead of the game, to get things before they might occur. And the home visits that are conducted by our nurses, mental health clinicians, social workers, other professionals with the training that's needed for that is very key. They're able to identify any risk factors that may exist and try and curb them, change them. You know, in America, in health, we often talk about lifespan. Well, we can keep people alive for a long time. And, you know, as a physician, here, I'd like to talk more about health span. How do we keep people healthier longer? You know, even with chronic conditions, how do we keep people as healthy as we possibly can for a longer amount of time? And do it in every way, whether it's, you know, their physical health, but also their mental health, their education, and the ability to be optimistic about your future are all things that are so important for the success of this program, and that's what we see here. So this program is an early example, or an example of early detection and upstream interventions that we can make. Because with prevention and better outcomes, future opportunities, this is what success looks like in the program. And that's what we're talking about, and that's what we're trying to do. And it's so important. Dr. Davis mentioned something about the broken man, and it's easier to mend the child sooner, and I agree with that. I was inspired at a young age when I saw the movie about Boys Town and Father Flanagan, and that was the premise there, right? You know, let's get them while they're young, and it's so much easier to have a better outcome. And I see things too, like Nationwide Children's Hospital in Columbus, Ohio. They talk about, you know, they take a per capita for Medicaid patients, so that means they're in charge of these kids' health, and this is what they get paid. And how do they make it work? They're proactive. They're out there making sure that kids are being seen, even if they have to go to their home to do it, to prevent things, to make sure they're getting their vaccinations, whatever the case may be. And I think that that's so important, and this program embodies that type of idea, to be out ahead of things and to make things better. So Ms. Coble, as a healthcare provider in particular, I'm interested in MICV's program and the ability to improve health outcomes for both the mother and the child. Can you walk me through the process and maybe an example of some of the success that you've had?
Absolutely. So with the amount of involvement that the nurse is having with the mom and with the family, you know, she's seeing her on a regular basis, so she can start to detect things when they're looking just a little bit different, or through conversations with the mom. Oftentimes, you know, our moms feel very free to call their nurse if they have any questions, and they're encouraged to do so. And we've had a couple cases where we've had moms that have had preeclampsia. And we had a nurse that was visiting one of our moms and took her blood pressure, and it was very high. And so she had her go on to the hospital, and where then she was admitted, and it was a successful birth. But had she not had that nurse by her side, the outcome would have probably been very different.
I appreciate that. And I do hear from physicians from time to time that they weren't familiar with the program. Can we talk about how we might create greater awareness?
Sure, we're trying, I promise you.
I believe
we are
you.
on social media, we visit WIC, we visit hospitals, we visit doctor's office. we just continue to beat the drum about the service. And we have a real good referral system in the South Bend area to help with that.
Thank you very much. I yield back.